Fasting guidelines for routine surgery patients. Fasting before surgery is an essential aspect of ensuring a safe and successful surgical experience. Proper fasting guidelines help reduce the risk of complications during and after the surgery, such as aspiration pneumonia. These guidelines are generally applicable to both adult and pediatric patients, but they may vary slightly depending on the patient's age, medical history, and the specific surgery being performed. Here are some key fasting guidelines for patients preparing for routine surgery, including pediatric patients. General fasting guidelines. Nil Per oral means nothing by mouth in medical terminology. Patients are usually required to abstain from all food and liquids for a specified period before surgery. Typically, adults are asked to fast for at least 6 hours before their scheduled surgery time, while pediatric patients may have shorter fasting times depending on their age and the type of surgery. It's essential to strictly adhere to these fasting instructions. Clear liquids. In some cases, patients may be allowed to consume clear liquids up to 2 hours before surgery. Clear liquids include water, apple juice, clear broth, and black coffee or tea without cream or sugar. However, this allowance varies from one healthcare facility to another, so it's crucial to follow the specific instructions provided by the surgical team. Medications. Discuss with your healthcare provider whether it's necessary to take essential medications on the day of surgery. Typically, patients are allowed to take medications with a small sip of water if needed. Pediatric patients. Age matters. Pediatric fasting guidelines take into account a child's age and specific nutritional needs. Infants may have shorter fasting times than older children. Breast milk and formula. For infants, guidelines often allow breast milk up to 4 hours before surgery and formula up to 6 hours before surgery. These times may vary depending on the child's age and the specific procedure. Clear liquids. Older children may be allowed clear liquids, like water and apple juice, up to 2 hours before surgery, but this should be confirmed with the surgical team. Communication is key. Parents or guardians of pediatric patients should communicate any concerns or questions about fasting guidelines with the healthcare providers to ensure the child's comfort and safety. Additional considerations. Chewing gum and hard candy. It's essential to avoid chewing gum and hard candy during the fasting period, as they can stimulate saliva production, potentially increasing the risk of aspiration. Alcohol and smoking. Patients should refrain from consuming alcohol and smoking during the fasting period, as these can increase the risk of complications. Hydration. Staying hydrated is crucial before surgery. Patients are encouraged to drink plenty of fluids in the days leading up to surgery unless otherwise instructed by their healthcare provider. Always remember that specific fasting guidelines may vary based on individual medical conditions, surgical procedures, and recommendations from the surgical team. It's essential to closely follow the instructions provided by your healthcare provider to ensure a safe and successful surgery. If you have any doubts or questions about the fasting guidelines, don't hesitate to discuss them with your healthcare team for clarification and personalized guidance. Your safety and well-being are their top priorities.